because what is a reimbursement presentation without slides with a bunch of codes on it? So let's see if this works. And if it doesn't, I can absolutely talk through.
Just use your, paint with words.
Exactly. So let's just see real quick. Since I had such success yesterday.
Oh,
are we casting?
We're good.
All right, great. So hopefully I won't put you to sleep with a bunch of discussion of the various codes.
There's money involved. We're good.
That's right. How do we get paid for everything? And take great care of our patients as well. So, I really wanted to go over kind of what this world looks like, post coronavirus. And I think it's important to step back, since we just heard from a couple of, amazing CEOs with great digital health technology, to think about where we were prior to this world. And one of the biggest difficulties in the uptake of digital health recently is this idea of how do we get patients to not only subscribe to this new idea of sending prescriptions out via devices, but then getting them to use them, right? And so what this kind of pandemic presents as an opportunity for physicians is the kind of the forced utilization of this new technology by your patients. And that doesn't happen very often. So I think one thing to think about is, how is this pandemic going to change the way that we are currently potentially, prescribing prescriptions to our patients, and what digital health technologies can we start to incorporate in our practice algorithms? So, effective March 6th, Congress signed the Coronavirus Preparedness and Response Supplemental Appropriations Act, which really gave the Secretary the power to dismiss any telehealth restrictions that existed prior to coronavirus for Medicare beneficiaries. And it really intended for the law to create new pathways for seniors in particular to receive care, so that they didn't have to go into acute care settings and potentially be exposed to the virus. Within this Appropriations Act, the 1135 waiver was also passed. And what this said primarily is that, and these slides will be sent out to everybody, but it really lifted restrictions on the use of telehealth services. So prior to this 1135 waiver, the patient had to have been an established patient. That's the primary, guideline. And then secondarily, these codes really could only be used for patients that were in rural settings. So that couldn't easily drive to a physician's office. And that meant that, and these are Medicare regulations, obviously not private insurance regulations, that really kind of, decreased the utilization of these codes and the uptick of digital health technology in general. So with these passages, Medicare said they will not only pay for telehealth services to patients that aren't already established, that don't live in rural health areas, but they agreed that the payment would be at the same rate as an in-person visit for any diagnosis. So not just services related to COVID-19, but this is really a push so that physicians can manage any condition from anywhere at the same rate that they were getting prior to this COVID-19 pandemic, which, and if you think about it from an overall perspective, is a really great thing and really can push the utilization of digital health and remote patient monitoring devices forward. So the other thing is physicians can reduce or waive cost sharing for telehealth visits. Now, there is this discussion about, what does that mean for the anti-kickback statute that exists? And so the AMA is really working with CMS to look into that. But physicians can provide telehealth services from their home. So prior, again, to this 1135 waiver, telehealth services, if you're, as a physician, wanted to provide that, you really had to be within the bounds of either the hospital you were working at or, your office. There also is flexibility as to what constitutes a device that can be used that is HIPAA compliant, right? So prior to the 1135 waiver, FaceTime and Skype weren't necessarily considered HIPAA compliant. Well, with this waiver, administration has said, absolutely use FaceTime. It's one of the largest widely available tools at the moment. And so they've really provided some flexibility as to what constitutes a device and what is HIPAA compliant. I think we all know that, the idea of HIPAA compliance within communicating with our patients through portals has been a little bit difficult sometimes from an uptick standpoint. So administration is looking at, how can we make it easier for our patients to communicate with our physicians? The AMA has some great resources, so I encourage you to really go to their website, and we will be sharing some of those as well. So, we talked about the fact that the patient doesn't have to be an established patient any longer. Well, we've outlined some of the codes right here that can be used for telehealth and billed for telehealth services, and those are the same codes that you've been using in the past. So I think we got a question earlier about what constitutes a level 2, 3, 4 visit. It's the same, information or guidelines or documentation that you have to really document if the patient were in your office seeing you for that type of visit. So think about that when you're doing it and discussing this with your patients. What is that medical decision making that you're kind of discussing? And you can see here there are 5 codes for new patients, and then 5 codes for established patients. So the other thing prior to the coronavirus is there were G codes established in 2019, and those will continue to be utilized going forward. And you can see that there's a big focus on inpatient telehealth follow-up, and then also some telehealth pharmaceutical management. So, the discussion that we were having earlier is very relevant. And then there's also a remote evaluation of recorded video. So if your patient, wants to show you exactly kind of what they're going through and they want to send it to you, they're really trying to look at how can we capture as much data as possible during this time. So we talked a little bit about remote patient monitoring. And I think that the big thing to remember from remote patient monitoring and the big question out there is what constitutes a device that's able to be used for remote patient monitoring. And Johnny Ross kind of touched on this earlier, but there was another big change that really recently happened. And prior to 2019, physicians were the only ones who are allowed to bill for and practice remote patient monitoring. And in 2019, we saw a technical correction to the CPT code 99457, which allowed for incident to billing, which basically means that nurses and licensed care managers are actually now able to bill for and perform remote patient monitoring. And this was really under the guise of wanting to free up time for, our physicians to be able to practice at the top of their license. So, we've provided a link here that kind of discusses that change more in depth, but that was a pretty significant change. What does that mean for your practice? It just means that as more of these devices really, pop up and your patients are able to kind of use them to really track their conditions at home, you can actually have some of your nurses or some of your personnel that have downtime potentially, and you can really kind of engage with your patients in a different way than maybe you had before. So we've included the codes here and their descriptors, and you can see here that, there are a couple of examples of what constitutes remote patient monitoring. Obviously, recording of weight, recording of blood pressure, pulse oximetry, respiratory flow rate. So it really has to do with something related back to either a vital or something that you would be documenting in the chart. One thing I did want to clarify, though, is that there were 23 codes that were released recently to help clarify the services that fall under remote patient monitoring. So even if maybe it's not included in the descriptor right here in the code descriptor, I would follow up with your specialty society or somebody that you work with within your hospital to really discuss what is remote patient monitoring constituted under our definition. And with that, I will turn it back to Robin.